Now that we know the criteria for hypertension, let's discuss its classification. There are generally two types of hypertension: primary hypertension and secondary hypertension. Primary hypertension refers to hypertension without a clear cause. We don't know the culprit or why it developed. Approximately 85% to 90% of hypertension cases are primary hypertension. Although primary hypertension lacks a known cause, it is typically associated with multiple factors. I have listed several common factors below. 1. Age. Age is a very important factor in developing hypertension. The older you are, the higher your risk of developing hypertension, as the large arteries gradually become stiffer with age, reducing vascular elasticity, and the smaller arteries also narrow, making it easier for blood pressure to rise. 2. Lifestyle factors. Many aspects of daily life can influence blood pressure. I will list several common behavioral habits that affect blood pressure. 1. Smoking. Nicotine in tobacco stimulates the sympathetic nervous system and constricts blood vessels. Long-term smoking can lead to arteriosclerosis, causing blood vessels to narrow and harden, which can result in hypertension.
Lizzie, meet Tancred Baumgartner, 64. History of hypertension and peripheral vascular disease, 80-pack-year smoker.
2. Alcohol consumption. Excessive alcohol consumption over an extended period can stimulate the sympathetic nervous system, increasing heart rate and blood pressure. 3. High-salt diet. Long-term consumption of excessive salt can lead to increased sodium levels in the body, which can increase blood volume and cause blood pressure to rise. 4. High-calorie diets and obesity. High-calorie, high-fat diets can lead to obesity. Obese individuals have increased body fat, which increases the areas requiring blood supply, thereby increasing the heart's workload. The heart must pump blood more forcefully to deliver it to distant areas. Additionally, obese individuals have heightened sympathetic nervous system activity. This means the body is in a state of heightened alertness, similar to the fight or flight response, leading to tension, rapid heartbeat, shortness of breath, sweating, and poor sleep. The increased cardiac workload combined with sympathetic nervous system activation can result in elevated blood pressure. 5. Lack of exercise. Many people today spend long hours sitting at desks, and many office workers lack physical activity. Inactivity affects the body in various ways, such as weakening blood vessel function, causing weight gain, disrupting the nervous and hormonal systems, and disrupting metabolic balance. These changes can all contribute to elevated blood pressure. All right, the above are some ways in which lifestyle affects blood pressure. Psychological factors. Another factor affecting blood pressure is psychological factors. Long-term stress, anxiety, or depression can cause the sympathetic nervous system to remain in an excited state, leading to vasoconstriction and elevated blood pressure.
This ain't gonna fly, man. The Ricans, we got genetically higher blood pressure, you know that? My cousin, he died from too much stress.
Genetics. Genetics also plays a role, as hypertension has a clear familial predisposition. If parents or immediate family members have a history of hypertension, their children are at a higher risk of developing hypertension. For example, African Americans have a very high rate of hypertension. Besides socioeconomic factors, a significant reason is genetics.
That's because almost 40% of black men have it. That means that almost every single black man either has high blood pressure or knows a black man who has it.
Now, let's look at secondary hypertension. Secondary hypertension refers to hypertension caused by other specific underlying conditions. It has a clear underlying cause, and 5% to 15% of hypertension cases fall into this category. There are many diseases or factors that can cause secondary hypertension. This table lists some of them, and I will list and explain some common diseases and factors here. The first is kidney-related diseases. Kidney diseases are the main cause of secondary hypertension. As I mentioned earlier, the kidneys play an important role in regulating blood pressure. If the kidneys are not functioning properly, the body's ability to remove sodium and water is impaired, leading to an increase in blood volume and, consequently, elevated blood pressure. Second, atherosclerosis. Atherosclerosis refers to the process by which arterial walls thicken and harden due to the deposition of substances such as fat, cholesterol, and calcium. As people age, especially after 40 to 50 years old, vascular elasticity gradually decreases and the elasticity and flexibility of arterial walls diminish, making them more prone to hardening. Atherosclerosis can lead to hypertension. Third, endocrine disorders. Endocrine disorders involve diseases of the endocrine glands, such as the thyroid, adrenal glands, pituitary gland, and pancreas. These glands secrete hormones which transmit signals through the bloodstream to regulate various physiological functions in the body, including metabolism, water-salt balance, stress responses, and, of course, blood pressure. Common endocrine disorders include hyperthyroidism and diabetes, both of which can cause hypertension. Fourth, medications. For example, some cold medications, pain relievers, contraceptives, and certain psychiatric medications can cause blood pressure to rise. Fifth, drugs. For example, cocaine, methamphetamine, and amphetamines. These substances strongly stimulate the sympathetic nervous system, releasing large amounts of norepinephrine and epinephrine. These hormones can rapidly cause blood pressure to rise. The above are some of the diseases and factors that can cause secondary hypertension. I would like to add a note about coffee. Coffee is a very common beverage in daily life, and many people believe that the caffeine in coffee can cause blood pressure to rise, so they recommend avoiding it. Regarding this issue, I will explain that the caffeine in coffee can stimulate the central nervous system, promote the release of adrenaline, cause vasoconstriction, and increase heart rate, leading to a temporary rise in blood pressure. However, this effect typically lasts only 1 to 3 hours. The impact of blood pressure fluctuations caused by drinking coffee on the body is actually very small. Additionally, drinking coffee has many other benefits, such as improving attention, enhancing mood, protecting cardiovascular health, and promoting metabolism, among others. As long as you are a healthy individual and do not consume excessive amounts of coffee, it is a very healthy beverage. For me personally, I drink coffee almost every day to stay alert while creating videos.